Good afternoon, everyone. My name is Glenna Raymond. I'm the President and CEO of Ontario Shores Centre for Mental Health Sciences, and I'm so very pleased to welcome all of you here today to be part of the special announcement that we are enhancing adolescent mental health literacy in Ontario. We know that the first symptoms and the onset of major mental health disorders develop in adolescence and early adulthood, but that individuals in this age group are often the least likely to access mental health care. Research shows that 1 in 5 children and youth under the age of 19 suffer from some form of psychiatric disorder. So that's 560,000 youth in Ontario alone. Those numbers are staggering. And yet 75% of those children and youth have never obtained the specialized treatment that they need. As a public hospital that offers specialized treatment for adolescents to seniors, we at Ontario Shores regularly see patients come into our care that were not identified with mental illness at that early age. So as healthcare providers, educators, and of course parents, we all want to create a place where young people can flourish, feel safe, feel cared for, and help them in achieving their goals. Part of that is creating a society that supports young people when they face struggles, whether they're physical or mental, shouldn't matter. We are so proud of this program and our partners in helping bring mental health curriculum to our high schools. Through education and awareness, we can help educators and students identify the issues earlier and help direct them to the help that they need. We can also foster an environment that supports and doesn't discriminate against those young people who are facing mental health struggles. At Ontario Shores, we are committed to advancing and integrating the mental health care system, engaging in research and teaching, raising awareness of mental illness, and reducing stigma. And this work is really what brings us here today. School is such an important place in young people's lives, perhaps parents too, but definitely the young people's lives, and their experiences at school directly and indirectly impact their mental health. Through multi-sector collaborations, like we are showcasing here today, we can create a safe environment for youth to learn more about mental health and, if needed, to seek treatment and recover their best health. Today's event celebrates how together we are now one step closer to providing enhanced mental health literacy for youth. Back in October, last fall, Ontario Shores launched the Adolescent Mental Health Literacy Program. We partnered with Dr. Stan Kuchar, a leading adolescent psychiatrist, to bring mental health curriculum into the classrooms of 17 schools across 4 different school boards: the Durham District Board, Durham Catholic District, the Kawartha Pine Ridge, and the Peterborough, Victoria, Northumberland, and Clarington Catholic District School Board. That early work and this initiative sparked overwhelming interest from school boards across Ontario, showing a need and a desire for this same type of education and awareness. And today we're pleased to announce that we are expanding the Adolescent Mental Health Literacy Program to 4 new school boards and 2 private schools. So welcome today with us the Toronto District School Board, the Toronto Catholic District School Board, Thames Valley District School Board, Waterloo Regional School Board, St. Clement's School, and Upper Canada College. As well, we're very excited that our original 4 school boards have made a further commitment to this initiative and have sent additional staff to be trained this week as well. So we're so pleased that several school boards have already adopted this curriculum. And I'd like to share some feedback from a student at Clarington Central Secondary School. There were so many comments and so many remarks, it was hard to just choose one, but this is from a student in Clarington. Quote, "By making people more aware of what mental illness really is, we could get rid of the stigma completely. Posters, pamphlets, and presentations would be great to spread the word. But going into schools and informing the young is the best chance of getting rid of stigma. The more people know, the more people will know what to do when the occasion arises where someone they know becomes mentally ill." Such a simple thought, but a powerful and thoughtful statement from one of our students. It truly represents why we are all here, the important work that we are all doing together, and the impact of that work. It truly is about the students. So for the past 3 days, secondary school teachers, other educators, and allied support staff have been participating in the education and will be getting ready to introduce the mental health curriculum into more than 60 schools throughout their boards across Ontario. The short video that was playing earlier is part of the You're Not Alone awareness campaign that accompanies the curriculum. It is designed to increase awareness of mental illness, promote early identification of symptoms, reduce stigma, and serve as a booster to the education itself. The campaign we have includes a print and digital component as well. Posters and printed materials are displayed in schools, local community areas, and a short video is being played in schools as well as targeted Max Milk convenience stores. In addition, Ontario Shores has facilitated training to primary care and community mental health providers so they are equipped with knowledge and expertise to respond to their patients in need of mental health care, a component of the program that is particularly important to Ontario Shores. It is now my pleasure to introduce Dr. Stan Kuchar. He's an internationally renowned psychiatrist and expert in adolescent mental health. Dr. Kuchar, the Sun Life Financial Chair in Mental Health, along with other partners, including the Canadian Mental Health Association, created a comprehensive mental health curriculum for schools. So I'd like to call Dr. Kuchar to the podium to say a few words.
Thank you very much. I think that this is a very important day in a very important journey which is still in its very earliest phases. There is a Chinese proverb that says, a journey of 1,000,000 miles begins with the first step. We are probably on step number 2, which is good because that's better than step 1 and it's better than not moving. And this journey, the purpose of the journey, is to improve the lives of young people and their families. The purpose of this journey is to try to, whenever possible, promote good mental health, prevent mental disorders, and, absolutely necessary, identify and effectively treat them if and when they occur. We are all committed to this journey. We can't make this journey alone. And I think what really I find tremendously positive about this is that we're all in it together. Ontario Shores is playing a very important role in moving us forward. Canadian Mental Health Association is playing a very important role in moving us forward. The different school boards, I recognize so many of the people here who now have become friends and colleagues when I, a year ago, didn't even know who they were, are taking a tremendous and courageous step forward in moving this forward. And one of the things I just have to say that it's a pleasure and a privilege to be part of this. I want to give tremendous recognition and kudos to Cynthia Weaver and Jeff O'Connor because they have put countless hours and amazing energy into this process. Without them, this would not be happening. And without everybody here, this would not be happening. But you know, as successful as we have been so far, this is really just the taste of where we need to go. I had the privilege to be at an event with the Toronto District Catholic School Board last week. And one of the speakers talked about imparting the thirst for knowledge. How important it is to make people thirsty for more. In Cape Breton, that has a completely different meaning. But here in Toronto, maybe we'll just keep it the thirst for knowledge. You know, the definition of someone who has problems with alcohol is that they drink more than their doctor. But we need to move ahead, and creating this thirst for change is fundamental. So I'm really looking forward to working with everybody here, and also all of us working with people who aren't here, because it's the people that aren't here where we have to go next. So I'm looking forward to the next steps. I'm looking forward to the next steps with everybody here, and I'm looking forward to the next steps with all the people that aren't here yet. So thank you very much for your leadership, and thank you all very much for your participation. Thanks again.